Good day, everyone. My name is Amaros Dolo, a BS Nursing 1B student from University of Eastern Philippines, handled by Professor Jenny Dichan in her health assessment subject, school year 2021 to 2022. And for today's video performance, I will be showing you how to properly assess the skin, hair, and nails. But before I start with that, let me show you the equipment that we'll be needing in assessing the hair, skin, and nails. So first, we have here a lobs. Next, we have to use a pen light or alternative flashlight. Then, an exam light or wood lamp. If available, go to a place with that is bright. And next is magnifying glass, and last the centimeter ruler. So here I already give you the complete materials or equipment that we are going to use later. So let's get started. And now I'll be assessing the patient. So good day, ma'am. I'm your nurse for today, student for University of Eastern Philippines. So may I ask, ma'am, which language do you prefer?
English and Tagalog.
Okay. So ask ko lang po, your name. May I ask your name po?
I am Veronica Alfonso.
What about your birth date, ma'am?
February 8, 1998.
Your age po?
I am already 24.
Okay, 24. So for today, ma'am, I'll be assessing your skin, hair, and nails. And for me able to assess those parts, so may I ask ko lang na is it okay to touch your certain parts of your body?
Yes.
Okay. So rest assured lang, ma'am, no, na that all documents na manonoted dito sa findings and any confidential between me and other physician that will be referring to you. So okay lang ba yun, ma'am?
Yes.
Okay, so ma'am, I'm doing this hair, skin, and nail assessment nyo, So this could be provide a data may reveal a local or systematic problems or alterations in a client self-care activities like local irritation, trauma, or disease that can alter the condition of the skin, hair, or nails. And systematic problems related to impaired circulation, endocrine imbalances, allergy reaction, or respiratory disorders. So it may also be revealed with alteration in the skin, hair, or nails. So now I'll be asking some question of part of your past history. So para malaman ko din. So do you have a skin problems like rashes or lesions?
Wala naman po.
Okay. What about dryness of the skin?
Wala naman po. Parati ako magulo.
Okay. What about, is there any changes in lesion appearance in your body, ma'am?
Wala naman po.
Okay. What about feeling changes na parang minsan nape-pressure kang nararamdaman?
Minsan sa school.
May pain po ba kayong like pangangati,
Wala naman.
vesicles, pustules,
Wala.
nodules, tumors, chickenpox?
Wala po.
Okay. What about hair loss?
Meron po.
Okay. Sa nail changes ba? Sa may body part?
Sa nail,
Nail?
wala naman po. Okay naman po.
Okay. What about body odor?
Wala po.
Okay. So what about in previous problems sa hair? Yung naliligo ka po ba minsan? Meron ka bang hair loss or changes?
Yes po, meron.
Meron. So yung time na hindi ka pa naliligo?
Meron din po.
Okay. May changes ba sa nails? Like, nag-yellowish, nag-brown?
Hindi po. Wala naman po ako napapansin.
Yung feeling rough?
Wala naman po.
Okay. Wala naman. What about allergic reaction sa food or any medicine?
Wala naman po ako. Allergy kahit ano.
So, dito naman tayo sa family history. So, meron ka bang previous problems with the hair, skin, or nails?
Wala.
Na kung nakaka-receive ka ba ng treatment,
Wala.
like
wala.
sa salon, para sa buhok,
Wala po.
wala. Sa kuko po, meron ka bang piniti?
Minsan po nagpapamanicure ako.
Minsan. Okay, so,
Pigmentation.
okay. Nagpapa-surgery ka ba din ba?
Hindi
Like
po.
inject?
Wala po.
Okay. Next, have you had a fever or nausea?
Wala po.
Vomiting?
Wala naman po ako napansin.
In your respiratory problems?
Wala po.
Okay.
Okay na.
Hindi ka naman po, di ba, buntis?
Hindi po.
Hindi. In your menstrual periods regular po? Regular din po ba yun?
Yes po.
Okay. Do you have a history in anxiety,
Wala po.
depression, or any psychiatric problems?
Wala naman po.
Wala. Allergic reaction. Have you ever had a allergic in skin, sa pagkain, medication,
Wala po.
sa plants po, or other environment substances like
Wala
dust?
naman po.
Okay.
Wala naman akong allergy.
What about sa lifestyle and practices? Dito naman tayo. Meron po ba kayong daily care na ginagawa?
Meron po.
Okay. Meron ba kayong family history sa skin problems or skin cancer like carcinoma?
Sa natatandaan ko po, wala naman po ako na mabalitaan.
Sa life health practices, na-expose ka ba lagi sa sun or chemicals?
Hindi po ako
Okay.
kalabas na tao.
Okay. Ano po yung daily care of skin, hair, and nails?
Nagpa-conditioner po ako sa hair ko, nag-shampoo,
Ah.
tapos sa skin naman, nag-lotion, nag-skincare, sa nail, sa nail naman, wala naman
Wala
masyado.
Okay. Nag-shampoo ka ba lagi? Or alternate?
Hindi, alternate po.
Okay. Naglilinis ka ba ng kuko?
Pag mahaba na,
Meron ka bang ginagamit na pampaganda, beauty products?
yes po.
Gaya ng lotion, cosmetics? Okay. And yung usual diet and exercise patterns, nag-ano ka ba? Nag-exercise?
Yes po.
Okay. So, food patterns. What kind of foods do you consume in a typical day?
Yung mga healthy foods po, like
Okay.
gulay, tapos yogurt, tapos yung fiber bar.
Fine. What are the foods that you're eating daily naman?
Pag sa cheat day po, hindi naman ako kumakain din naman ako ng paminsan-minsan ng baboy, tempo, hapa.
Nag-exercise ka ba ng mga heavy activities? Or
Hindi po. Yung madadali lang na exercise sa bahay lang naman ako nag-exercise.
okay. What kind of foods do you consume in typical day? Cut na natin. How much fluid do you drink each day?
6 po. 6
6
glasses
glasses.
of water.
Okay. Do you have any skin problems? Nagkaka-rashes ka ba while doing activities?
Wala naman po kami certain activities.
How much stress do you have in your life? Stress ka ba?
Hindi naman po masyado.
Okay.
Minsan meron.
And for the last, do you perform a skin self-examination?
Hindi po.
Hindi naman. So now, I'm done asking a question and now I am going to assess your skin, hair, and nails. So I will give the patient's gown. So before I'll start, I will perform a hand hygiene. After a hand hygiene, I'll just close the curtains to provide a privacy to my patient. So I already provide a privacy of the patient, and my patient already wore a lab gown. So now I'll be starting the assessment. So first, I'll just wear eye gloves. And next, I will ask my patient if she has a jewelry. So, ma'am, do you have any jewelry?
Wala naman.
So, okay. So, do you have any Q-tips in your nails?
Wala.
Okay. And now, I'll be inspecting the skin of the patient. So, ma'am, I'll be inspecting the skin of the color of your variation of the skin. So, may I ask to touch your skin, ma'am?
Yes.
To inspect that. So, you have to inspect if there's a scars or stretch marks. Okay. So next, I'll be using a magnifying glass to see if there's a presence of your skin. So, so I observe, ma'am, that your skin color is light brown, and may na-observe akong quite few moles in your face and your neck, and wala naman akong napansin na skin breakdowns, and wala naman ako ding napansin a primary, secondary, or vascular lesion, and I observe that your skin is quite intact. So next, I'll be performing the texture of your skin. So, can you please hang in your arms like that? So, let me this. So I observe that there are no presence like stretch marks or scars with your arm. So next, I will palpate the texture and consistency using my dorsal part of my hand. So I will check the temperature of your forehead. And your arms. Okay, so I observe that your skin is warm and hindi naman dry yung skin nyo at hindi naman oily at moist lang siya, and that's good to know, no? So next, I'll be assessing your trigger of your skin. So ipipinch ko lang, ma'am, yung skin nyo. I have to pinch this. So next, I will feet, ma'am. Inspect. Watch if there's an edema. Okay. So, I observe that there's no presence of edema nung tinouch ko po yung feet nyo. And nung pininch ko naman po yung skin nyo for the trigger test, meron naman siyang mobility and bumalik naman agad yung skin sa normal. And last, I'll be inspecting the nail of the patients. So, ma'am, may I? So next, I'll be pinching the nails of the patient. So, okay. I observe that your nails are quite groomed and malinis naman at nakadikit naman siya at wala namang nakaangat or any loosen of the tissue sa ating nails, no? So, next, I will inspect the shape of your nails. So, ma'am, can you please do this? To inspect the shape of your nails. So, okay. So, I observe that you have a 160 degree of your shape of sa nails ng kuko nyo, and that is normal. And I observe that your capillary refill or blushes ay bumalik naman agad sa pagkapinto ng nails nyo. And habang pinipinch ko naman yung kuko nyo, it is normal that your nail is pink, and that's good to know. So after assessing the hair, skin, and nails, I will record or take note what my client said to me of my observation. And now, I'm done assessing your hair, skin, and nails, ma'am. So, thank you for your cooperation. And now, I will doing a nursing diagnosis. So, a nursing diagnosis is a short and it has a three-part statement that forms the basis of a nursing care plan. So, drafting the hypothetical nursing care plans is a critical thinking exercise of a nursing student, unlike a medical diagnosis, which identifies a specific disease or medical condition. So, a nursing diagnosis analyzes the patient's needs. So, the first part in collecting and analyzing data. So, first we have to observe the patient. Then we have to formulate the basic description of the problem the patient seems to be having based on the signs and symptoms you see. So next, we have to talk the patient and other their loved ones about how they're feeling about your actual nursing diagnosis. That includes information from the patient as well as those around them. So their family members and friends can provide details about the changes in patient's behaviors and appearance. So next, we have to evaluate the patient response to their symptoms. We have to consider the patient's attitude and their treatment of people around them, including their loved ones and healthcare providers. So first, we have to distinguish between objective and subjective data. So the subjective data is what the patient tells about you of how they feel. It is the prescription and can be verified, while objective data is on the other hand comes from the observation that are measurable and verifiable using these scientific method. So the next is the data is to have to support the actual diagnosis maybe either objective or subjective data, generally is more important in forming the basis of your diagnosis. So next, we have to identify the problem that your nursing diagnosis will address. So look for the address in data you've gathered. Various signs and symptoms might cluster together that point to the correct diagnosis. And next, we have to focus on the experience of the patient and those around them, not the medical diagnosis. So a nursing diagnosis may reflect the individual. So no two nursing diagnosis will be alike, even or for two patterns diagnosis with the same condition. So now I am going to check the patient referral form. So the date today is April 23, 2022. So the referring patient information. So the name of the patient is Veronica Alfonso, and her date of birth is on February 8, 1998, and her age is 24, right, ma'am?
Yes.
And her address and her zip code and her contact number, which is confidential. So preferred name, contact number. Okay. And her mother's name, Carmelita Alfonso. So the reason for referral of Miss Veronica Alfonso was preferred of her hair, skin, and nail assessment performed by nurse me, Emmy Rose Dolo, and observe if there are any problems, abnormalities, or disorder that Miss Alfonso experienced to elect the information by asking some relevant questions and timely insight to health condition of Miss Alfonso, and can point out some early symptoms that may require early attention. Hence, the assigned nurse would better understand about Miss Alfonso overall evaluation. So we have here the health summary and subjective, the actual diagnosis. So I inspect earlier that she has that her skin has no problems like rashes, lesions presented. Next, the client said there is no dryness of her skin, oiliness, drainage. So far, my client said that she finds no changes in her lesion or appearance in her body. So next, the client often feels pressure. She also added that she don't feel any pain or itchiness like vesicles, pustules, nodules, tumors, cysts, and so on. So my clients also said that there is no presence of her there is a presence of hair loss in the time she is taking her bath or even not taking. So my client said that there is no body odor and no problems with her nails, no changes presented, no yellowish or brownish in color. So it is normal and there is no rough surface, no? And also she said she has no allergic towards food or any meat. So next, the subject. So next, the clients also said she has no previous problems with her skin, hair, or nails in receiving her treatments. So clearly to say that the patient don't receive any treatment coming from the salon. She also make her nails look clean. So my clients also said she didn't receive any treatment, no surgery or injection, respiratory problems, that my client menstrual cycle is regular. So also, she said that her family history has no risk for anxiety, depression, or any psychiatric problem, and she did not visit a psychiatric. So she also has no risk for any disorder or condition in her hair. So the client has no risk for skin problems like carcinoma and so on. And she also said that she has no risk exposure to the sun or chemicals. So next, My clients also said that she has no readiness to explore more in having her hygiene or daily routine care. The client do sometimes shampoo her hair, cut her nails. She uses shampoos, lotions, or other cosmetics. She did not uses a self-tanning products. On the contrary, she always uses whitening products. She did not use razor, hairspray, or any coloring or nail any. So my client and her nails, if it's so long, so my client do exercise moderate in 2 weeks, twice a week, I mean, and she do not feel any skin problem in her doing the activity. So my clients eats vegetables, fish. She also drinks 6 glasses of waters a day. So my client is often stressed. She did not go to skin examination once a month. So the objective of the diagnosis, they have no condition or any disorder presented, as well as my client has no risk of any disorder or condition in her hair, no balding, no spots or presence like alopecia, hair loss, scars, oiliness, hairless, even the distribution of the hair on her hair. So the hairless in the distribution of the hair lesion, lices, or bugs, the dandruffs like ringworms, etc. that my client colored her hair is on. So next is the objective. So my patient has no condition or any disorder presented, as well as my client has no risk for any disorder or condition in her hair. No like no balding, spots, or any presence of alopecia, hair loss, oiliness, hairless, even the distribution of the hair lesions, lices, or bugs, dandruffs, and so on. So my client colored her hair on last January, right? So I observed that my client skin color is light brown, and I observed that she has a white moles in her face and neck, and she has no skin breakdowns, as well as no primary, secondary, or muscular lesion, and I observed that her skin is quite intact. Additionally, there is no jaundice or abnormal moles, rashes, or scars, or any no sunburn, or even may have carotene overload. So I've observed that there are no presence like stretch marks or scars with her arms. So also I observed that her skin is warm, and I didn't see any dry of her skin. It is not also a oily, and it is moist, and it is good to know her that her skin is moist. So next, I observed that there are no presence like edema in her feet. I'm doing the Turgor test of my patient. There is no the mobility, and her skin spring back to a usual position while doing a Turgor. So I observed also that my patient nails are quite groomed and clean, and there is no any loosening of the tissues in her nails. So also I observed that Miss Alfonso's nails have a 160-degree shape, and that is normal. And I observed that her capillary refill or blushes will return immediately to the pink tone of her nails while the nails are pinched, and that is a good sign. So the second part is to identify the related factors. So first, we have to look the source of the patient's problem. Once you've diagnosed the problem, you'll address from the nursing perspective, then figure out why the patient is having that problem. This will help you to decide what nursing interventions will help you to work a alternative, alleviate the problem. So next we have to evaluate the patient history and overall the health. Then review the patient's chart and records to determine the factors related to their current condition. Lab reports and conversation with other healthcare team members may also relevant. So next, we have to include the potential problems when determining related factors based on your knowledge of the patient's condition. And next, we have to list the symptoms or issues they might experiencing due to their current symptoms while undergoing the treatment. So now, here, the patient's mother, Mrs. Carmelita Alfonso. So here, the mother's patients, Mrs. Carmelita Alfonso. So ma'am, I'll just ask some question regarding your daughter's condition in her hair, skin, and nails. So ma'am, is it true that your daughter don't receive any treatments coming from the salon?
Opo.
Is it true ma'am that she didn't receive any treatments and surgery or injection?
Wala naman so far.
Okay. In your family history, you don't have any risk of anxiety, depression, or any psychiatric problems?
Wala po.
Well, is it true, ma'am, that your daughters don't expose the sun or any chemicals?
Hindi naman.
Okay.
Pansin ko.
So, thank you, ma'am.
Thank you.
So now, in third part, in making a diagnosis, so we have to make a clinical judgment. So first, we have to find the most appropriate nursing diagnosis. We have to look up the official terminology for the problem you observe. Use a NANDA book, here. Use a NANDA book and other nursing textbooks you have to guide you. So we have to also write down the official terminology. You find that the best suits the needs and conditions of the patient. Once you have a nursing diagnosis, you can look up the potential outcomes and nursing interventions that are appropriate for your patients. We have to consider how each of this applies to these particular patients. Next, we have to bring the related factors together for your diagnosis. Next part is we have to, in nursing diagnosis, we have to list the related factors or causes of the patient's problems. We have to look up the standardized terms of these factors in your textbooks if you don't have already know them in this part, and you have to make sure your work within the doctor's diagnosis. If the diagnosis is not final, you have to refer to the working diagnosis. So next, we have to summarize the overall data or overall diagnosis. So the patient have no condition or any disorder presented. As well, my client has no risk of for any disorder or condition in her hair, like no bulging, spots, or any presence in her hair. I observed that my client's skin colors are light blonde, and I already observed that in her face and her neck, she has a white moles also in her arms. So also, I observed that my client's skin colors is light brown, and may na-observe akong a quite few moles in her face and neck, and she has no skin breakdown, as well as no primary, secondary, or muscular lesion. So I observed also that her skin is quite intact. Additionally, there is no like jaundice, abnormalities of her moles, scars, and she has no sunburn or even in-carotene overload. So I observed too that there are no present like stretch marks, scars on her arms. I observed that her skin is warm and di naman dry ang skin at hindi naman oily at moist lang siya. At and that's good to know that her skin is moist. So next, I observed too that there are no presence of edema on her feet in doing a Turner test. Also, there is a mobility and their skin spring back to a usual position. Also, I observed that my patient's nails are quite groomed and clean, and there is no any loosen of her tissues and her nails. I observed too that Mrs. Alfonso nails have a 160 degrees shape, and that is normal. And I observed that her capillary refill or blushes will return immediately to the pink tone of her nails while the nails are pinched, and that is good a sign, no? So next, I have to refer the nurse. So the healthcare providers, me, Emmy Rose Dolo, and my signature, it's very important, and my address and contact number, which is confidential. And now, I am done assessing the hair, skin, and nails of my patients. That's all for today, and thank you.